Welcome back, 725. If you're just joining us, little recap, talking ADD and ADHD, a part of your back to school series.
Yeah, pretty common.
Yes, extremely common. Let's jump right back in
Absolutely. About 10% of the children have ADHD, which is actually quite a bit if you think about it.
No, really, it is, yeah. Talking about the changes over the past decade, what does that mean for Louisiana?
Oh, absolutely. I found this really fascinating.
Yeah.
That Louisiana is number 3 in the highest state of children with ADHD.
Why is that? Like, how does that?
No one knows.
Wow.
So in case you're curious, the winner is Kentucky, then Arkansas, then Louisiana.
Well, I fit right in.
Not Mississippi, which we're always fond of tracking.
Very interesting.
So the national average, again, is about 10%.
Okay.
We're about 5% over that average at 15%. Good news, though, we do very well in taking our medicine. We're about 7% in the over the national average in doing that. We're a little low on behavioral therapy. We're about 5% behind on that.
And that's just added therapy to taking the medicine, correct?
Oh, absolutely.
Yeah.
It's really
Which is very important, too.
Absolutely.
To kind of learn more about it and what you need. But let's talk about or continue with treatment.
Oh, absolutely. So it's a pretty complex topic, so we're just kind of doing an overview. They recommend behavioral therapy for younger children. They need to learn coping strategies and how to be less distracted, less irritable when things aren't working well. Older children really respond well to medication. We know with the current regimen, we have about an 80% success rate in decreasing symptoms.
Yep.
Yeah. Oh, and this graphic is great. So this is all the other things you can see with ADHD. Learning difficulty, behavioral problems, social, anxiety, depression. About 70% of the children have at least one of these.
Crazy, but it totally makes sense. You know, it definitely does. We have about, I would say, 15, 20 seconds left here.
Oh, some fun facts?
Let's do it. Yeah, fun facts. I know I could talk about this for an hour.
Well, again, 10% of the children have this, and about 60% of the children will actually outgrow this in adulthood.
Really?
So, yeah. Oh, I'm sorry. Actually, I'd say 60% will continue to have problems. 40% will outgrow this in adulthood. Wow. I reversed that with my ADD.
Yeah. No, that's a good sign.
And ratio, of course, boys greater than girls, 3-to-1.
Very interesting. And yes, we've been hearing that forever. Adam Olivier, we're going to send it to you for a check of the weather.
Isn't it interesting when you